Our next speaker is Dr. Meghan McCue. Dr. McCue is a postdoctoral researcher at McMaster University, working with Dr. Thomas Hawk and Dr. Irina Rybaka. They are studying the impact of type 1 diabetes on skeletal muscle and exploring the potential benefits of exercise. Fun fact about Meghan, she attended the midnight screening for every single Twilight movie, including lining up for several hours. No judgment. And quite frankly, she says she'd do it again and again. So there you go. Please welcome Dr. Meghan McCue.
All right, so I wouldn't blame you if muscle wasn't the first thing that came to mind when you heard type 1 diabetes, but hopefully after the next 5 minutes, it might at least be the second, and you know what? I would settle for the third. So type 1 diabetes occurs when the body is no longer able to produce insulin on its own. Insulin is the molecule that tells our tissues to open up their doors and let glucose in. This contributes to blood glucose control and also ensures that tissues have the energy they need to function. So without insulin, we can't really manage our blood glucose. Luckily, if you have type 1 diabetes, it can be pretty well managed with lifelong insulin therapy. But this therapy is really complex because blood glucose can be a little bit unpredictable. It's going to be impacted by what you've eaten, how much sleep you've had, if you're stressed, and something as seemingly unrelated as a sunburn can actually impact your glucose control. So balancing this all is really, really hard. And to make matters worse, even if you do a great job managing your blood sugar across the lifespan, the condition itself can actually impact tissues across the body. And one of those tissues that we're really interested in is skeletal muscle. Skeletal muscle makes up about 40% of the body, so it's a pretty significant tissue. It's also a huge site of glucose uptake and storage. And perhaps most importantly, muscle is what gives us the ability to be strong and independent across the lifespan. Work from our lab has found that muscle is pretty severely impacted in type 1 diabetes. And typical age-related losses in strength are actually accelerated sometimes up to 10 years, particularly in females. So we're losing strength at a faster rate when diabetes is present. We also found that following muscle injury or damage, individuals with type 1 diabetes actually have a slowed recovery. And this has implications for injury, illness, and bed rest. Now, we're an exercise lab, so we think, these are all factors that exercise might be able to counteract. Exercise promotes strength and recovery. It can improve our mitochondrial quantity and quality. And it may actually help mediate some of these blood glucose fluctuations to give better glucose control. And we're actually not the only ones who think that. In fact, Diabetes Canada actually recommends exercise for individuals with type 1 diabetes. But there are a few critical buts here. The exercise guidelines are the exact same as they are for everyone else in Canada. And perhaps even worse, no one has ever actually tested these guidelines in individuals with type 1 diabetes. So that's what we're doing. We are looking to determine if type 1 diabetes causes any baseline differences in muscle and metabolic health. And we also want to see if the exercise guidelines are able to restore these differences. In order to do this, we're conducting a study that follows the exercise guidelines set out by Diabetes Canada. We have participants both with and without type 1 diabetes adhering to 150 minutes of aerobic activity and 2 strength training sessions per week. They follow these rules for 12 weeks, and we assess them at the start and the end. Now, all of this exercise is done at home in the same way that it would happen in day-to-day real life. So we track activity using Garmin watches so we can see what types of activities you've done, how long you've exercised for, and if you've actually met the targets we've set out for you. We track blood glucose using continuous glucose monitors, which give us minute-to-minute information on blood glucose control. And in our laboratory visits at the start and end of the 12 weeks, we take a whole bunch of measures looking at stuff like strength, aerobic fitness, body composition, and what we're really interested in is actually taking a small piece of muscle so we can get down to the microscopic level and see if there are any molecular or structural differences in the muscle. From these results, we hope to accomplish a few things. We're trying to figure out the best type of exercise for type 1 diabetes. And through this, answer, are the guidelines sufficient? Are they cutting it? We also want to find the areas of greatest loss or gain so that we could better target these with other interventions. And we also want to develop programs that are going to support exercise for individuals with type 1 diabetes across the lifespan. Ultimately, we're looking to improve both the quality and quantity of life for the over 300,000 individuals currently living with type 1 diabetes in Canada. And we hope to do this by keeping them as strong as possible for as long as possible. Thank you.